Yeah, we're going to the South Bronx, and all the stories you heard are true.
I would say that the mission is trying to meet people where they're at, because that's where they're at. And if we try to make them be somewhere they aren't, we'll lose them. So right now there's a big gap for people who aren't in treatment.
We work with a lot of drug users, a lot of people who are homeless. We work with sex workers. Like everywhere we go is like a really high drug area. We're in the South Bronx now, and we're gonna go to St. Mary's Park for a second, which, you know, they sell a lot of drugs there, mostly coke and heroin. The guys are in there, you know, usually like Latin Kings or Nietas. All those guys over there, they're all selling drugs and stuff, mostly.
For those who work at the Corner Project, it's all about meeting people where they are, emotionally, physically. So sometimes that means bringing their services to the people who need them.
Where we are right now in the South Bronx is actually the highest rate of overdose.
Even on a slow day, we'll see anywhere from like 30 to 45 people.
In New York City, more people die of drug overdoses than homicides, suicides, and motor vehicle crashes combined. Half of all overdose deaths in the city come from fentanyl, a powerful synthetic opioid.
There's very, very little heroin itself on the street. What most people are buying is fentanyl. They just aren't aware of it. The appearance of that drug actually just makes it so much more dangerous because it's so much more potent.
So Sam and Axel set up shop wherever they know they can be most helpful. They hand out fentanyl test kits and show people how to use them.
So I just basically put the dipstick in like this. So if we have one line, that'll be a positive result.
But as deadly as fentanyl is, Sam only encourages users to be careful if they get a positive result.
We can't tell them not to use. That's not really our decision, that's their decision.
They'll give out condoms, hepatitis C tests, and even train people how to use the overdose reversing drug Narcan.
Tilt the person's head back, put this in the nostril, and just spray in.
It's about arming people with the tools they need to be safe where they're at.
So these are definitely our most popular syringes because they are small. They're easy to conceal, easy to use. So this would be a box of 100 syringes. And we do very often give a box or two out to folks just because they themselves may not be using it themselves, but they may have several friends who also use, and they just don't have the time to go to the site.
You know, but whatever they want to do, we respect that. We don't judge anyone, and you know, try to help them out as much as we can.
For most people working at the Corner Project, they understand this struggle firsthand.
Someone bumped into me back in like 2007, and at the time I was using drugs and all that. And, you know, like, they were doing outreach, and they brought me into our office, and, you know, in spite of the way I looked and as high as I was and all that, they still treated me with respect. You know, like, I love my job. I got a second chance at life, you know what I mean? I was out here lost, you know what I mean? Like, all I was doing was getting high, killing myself. They gave me different suggestions, and they basically told me I could do whatever I want, and they will support me.
He now spends every day trying to help the next person on their journey. Carla Cardell does the same.
I used everything and anything for about 20 plus years. I got sick and tired of it and decided to go into a residential program. I graduated in 2007 and started working, and I was okay for about 7 years. And 2012, I had this bright idea of using a syringe. Yeah.
And you had never done that before?
No. I went to Corner Project and I saw everybody I knew. They cared and loved me till I learned to love myself.
Carla soon worked as a volunteer, then part-time. Now she's a full-time employee.
And I think there is this myth that somebody who is an active drug user is dysfunctional or incapable of functioning, and that's not the case.
She's cleaning up her community in more ways than one.
Under this bridge, I'll show you on the other side, there's people that live there, and that's why we go there and we pick up syringes. People just stop and use anywhere.
Carla will spend hours picking up needles wherever she finds them, at parks, under bridges, even on the sidewalk. making sure that if people use, they're as safe as they can be. Whether it's cleaning up the streets, handing out new syringes, or just giving someone a cup of coffee and a snack, it's about giving people back their dignity. So maybe one day someone will want to change their life, and they'll know just the place to go.